Welcome to Prepared for Parenthood, the podcast for hopeful, expectant, and new parents with little ones up to age 5. I'm your host, Dr. Stephanie Duger, a psychotherapist, author, educator, parent coach, and married mother of 2. On this show, we'll discuss everything from the most up-to-date practicals of best supporting your young children, to thriving in relationship as a family, to more surprising topics around the psychology and development of babies from conception through age 5. So sit back, relax, and enjoy. I'm thrilled to have you here today. Welcome back to Prepared for Parenthood. Our guest today holds a very special place in my parenting heart because along with being an amazing human on the planet, she helped bring our second child into the world during our 2012 home birth. Lo Kawulok is a mother, midwife, and community advocate who's been supporting women and families as a full spectrum reproductive health worker for about 20 years. She has a deep love for the earth, sacred relationships, strong communities, and a reverence for ancestral connections. Lo co-founded Community Roots Midwife Collective in Longmont, Colorado. She's learned the art of midwifery in various settings, ranging from rural to urban home birth, a bustling birth center on the U.S.-Mexico border, to international practice in Guatemala and Mexico. Lo is connected to the midwifery and spiritual traditions of the earth, her maternal line, as well as traditional healing practices passed down from the hearts and hands of her teachers. So welcome, Lo. I'm so happy to have you here today.
Thank you so much, Stephanie. It's wonderful to be here with you and such a gift to stay connected to your family.
Would you mind sharing a little bit about how you got into midwifery and how you ended up working in the places where you did?
I think there was so many layers for me looking back. In certain cultures, some people are raised up as midwives from a very young age, which was not the case for me, in the sense that I actually didn't even really know that midwives were still around through my adolescence. But I was raised up really close to the earth. We always had a garden. We were connected outside a lot and just really tuned into the natural cycles. So I think that had a really big impact for me, just shaping who I am as a human. And when I was actually in college, I was volunteering with hospice and studying women's health. So I was thinking about going down the med school route and was really blown away by what I learned from this hospice team when I was exposed to this in-home, really personalized care in reverence to this incredible physiologic process of death. I was also then invited to a home birth. So I was able to see both of these paradigms. And it was really in that moment that I realized this was something incredibly important for our lives and something I wanted to pursue. So I started going to births with those midwives right away and was given the wise advice to find some traditional midwives. And so from there, I traveled down to Mexico and was able to learn from some really beautiful indigenous midwives there and found my way to midwifery school in El Paso, Texas. From there, I have had the privilege to travel around and learn from midwives both here and further south in Guatemala as well, other parts of Mexico. And when I completed my studies at the birth center, I came back home here and did some apprenticing and started a small practice. And I've been practicing for about 20 years. And throughout that time, my practice has looked really different as well. About 8 years ago, I was one of the foundresses of Community Roots and started to form this collective practice, which has really been an incredible gift for me as well in the way that I practice and the way that we're able to work here in the community, and feel really blessed.
And would you mind sharing a little bit about how traditional midwifery and midwifery in general is different from the care that someone might receive in a hospital, say with an obstetrician or another kind of medical doctor?
Yeah. I'll quote a bit here one of my mentors, Robbie Davis Floyd, who is an incredible anthropological writer and researcher. And they really outlined what the differences rest upon. We can think about the conventional medical models or obstetric models being that of what they would coin as a technocratic model. So we're relying on technology. We are looking at the birthing person as a bit more in a state of needing medical support and intervention and a bit separated from mind body. And then we look at the holistic models of traditional midwifery, and it really encompasses the body, mind, spirit as one. So we're starting from this place of the lowest intervention possible. We're deeply honoring the culture and the lineage behind the individual and the physiology of the process of pregnancy and birth being a normal life process. So not looking at it as any sort of emergent or process that needs to be medically managed. So really leaning into the holistic pieces of the body and of the physiology of what is normal for labor and birth, and certainly tending to all of those aspects and not separating those parts of birthing people. Another really important difference there is that it's a shared decision-making model. In the technocratic model, there's more of a hierarchy that can exist in that conventional medical model where a doctor or physician is looked at as the expert and they're essentially managing the entire process. Whereas in the midwifery model, especially in traditional midwifery, it's really something that we're collaborating on. We're collaborating with our people. We see it as our responsibility to provide a robust amount of education and support, something that is culturally competent to who this person is and what supports them in their life and their wellness and their healing in general. And really making decisions together, providing what we're coming with our clinical expertise and all that we've learned from our teachers and all the incredible birthing families before us, and offering guidance and what we're seeing, what we're noticing, what we're witnessing. And then ultimately, the parents are making their decisions based on what they think is best for themselves. So that is a very big difference. And within that, it takes time and it takes dedication to our people and our communities. So, for example, our office visits, our initial visits are about 2 hours long. Our visits after that are about an hour long. We're spending a tremendous amount of people so that we can really focus on their health and wellness, getting to know them well. And then in that regard, it's easier for us to start to see when things may start to veer out of what may be a normal scope or a normal place for them. And we're able to tend some of those earlier signs of a complication starting to bubble up and tend to those things in a way that's usually really holistic and natural. That times is really different. We also don't separate birthing parent and baby. And that's an interesting thing that happens in the postpartum model of conventional care. But in more traditional midwifery, we're caring for them as a unit. And we have some really beautiful, comprehensive postpartum offerings. Our postpartum care is all offered in home as well for the first 2 weeks. So we see our people usually 3, 4 times in those first 2 weeks at home, certainly more if needed. Those visits are about an hour long. And then we have our folks come back to us at 4 and 6 weeks postpartum. So that's also a really big difference with midwifery care is that comprehensive postpartum piece.
So, being a person who was fortunate enough to be able to have both my children at home, I feel super blessed to have had the opportunity to do that and to have been physiologically and psychologically ready to do that. Who are the people who might not do as well in this kind of birthing model, birth specifically, who might do better in a situation that needs more directive care, perhaps?
In nearly all nations, midwives provide first line maternity care to childbearing people and newborns. However, here in America, the vast majorities of births are attended by obstetricians and certified nurse midwives. When we include the certified nurse midwives, about 10% of people birth with midwifery care. It's about 2.8% here in so-called Boulder County, as far as folks who seek a home birth midwife. It's an interesting thing. Throughout the pandemic, there was some research done because out of hospital birth we were realizing how important it is to have those sorts of situations and providers. So there was some interesting research done looking at things that actually put folks at a higher risk where birthing at home is not as an appropriate of a situation and as a setting. It is important that we're tending to folks who are low risk at home and certainly seeking a higher level of care if needed. We can estimate that's about 83 to 85% of our population. For a home birth, it's important that we're not holding some of the more serious chronic conditions. And we have some different regulations, and it actually varies state by state. But for us here in Colorado, that's things like hypertension, gestational diabetes, folks who may just need that next level of medical provision. And other than that, as I spoke to, most people are low risk and healthy enough to be birthing at home with a skilled provider. That said, it's also super important, and you, I'm sure, can remember this very deeply in your body, what people's preferences and beliefs are. Of course, not everyone feels safe birthing at home because it's become the norm here. There's just a lot of people who don't really understand what that means. They don't quite understand what a midwife is and the skills that we hold and the ways that our knowledge and expertise of what is important, making sure that we're well and safe to be at home. It is really important for that physiologic process to unfold in the best way. The birthing mama needs to feel safe. And that's can be a complicated and nuanced thing. That's a very important part of it and a big piece that we're working through and talking about during our prenatal care and journey with people. It's just trying to understand what helps them feel well and safe in their own space. That beautiful physiology of normal, healthy birth can unfold.
Yeah. And again, thinking back to my own births, I was fortunate enough to not have any complications and not need transport. I'm curious in your practice about what percentage of the birthing parents do need to be transported for various reasons.
Right now, we have about a 14.5% transport rate during labor. And the majority of that happens for pain relief, usually for maybe a long labor that we're working through. That's the main reason we go in during labor. And the reality is that sometimes folks are transported out of care prenatally if we have something that's cropping up, any issues with blood pressure and any signs and symptoms of preeclampsia, things like that can crop up at the end of pregnancy. We also sometimes have to transport in postpartum. It's not common, but maybe something will come up like an infection or something like that. So again, that's really rare in our practice, but those are also pieces and reasons that we may have to seek a different path.
You mentioned earlier, though, that midwifery work can positively not just impact individuals, but whole communities. Can you speak to that?
It's so fascinating how we culturally hold these rites of passages like birth and death. And it is really impactful for our communities and the ways that we come in and that we come out and how we hold those experiences. It's the way that we acknowledge that passageway into parenthood is a big deal for individuals and how they're able to show up as parents, and how they're then holding space for their little ones and their families. It's looking at perinatal health and all of the impacts on our little ones, the experience during gestation and through that birth process. We're now relearning, really, this is something our ancestors have taught us from forever, but really relearning the importance of that, how we hold those memories in our body. It really impacts the way that we then are walking in this world, not only physically and related to our health, but also emotionally and spiritually. And it's those profound experiences that we go through in life that really attune us to how we are interacting and how we're making decisions. Sorry about that. So much is formed in our early childhood development and behavior and through in our adulthood and as we're making parental decisions. And when we're able to really honor our parents and celebrate them for this incredible process and when they come into parenthood feeling in their power and supported, there is such deep wisdom there. Folks are able to be more self-reliant. There is a deepened sense of self-respect. All of those things are then shared with their children. And it forms and shapes the way that we are as a community.
One of the things that you shared with me, last time we connected, was that there was this beautiful mural that was created in between a couple of alleyways in Longmont, Colorado. And I've looked at photos of it. It's a gorgeous mural of a parent who looks like they've just birthed, holding a little one with all these beautiful colors. And you had a gathering to celebrate not just the mural, but the bringing together of your community there. Can you tell us a little bit about what that was like?
That was a beautiful dream come true. This is something that myself and my sister midwives and my dear colleagues here at the collective have been dreaming of for years. We're always thinking about how we can support our community to have a deeper understanding of what we just spoke to, of why it is so important to honor our birthing people, our water carriers, and the people in our community that support them. And there's different ways to touch and to reach people, and art is such an incredible way to do so. And so we've always dreamed of creating some sort of mural that held those aspects of the sacredness of this process of birth, the process of death as well, so intimately connected and close to one another, and the beautiful things that support that process. We'd been thinking about it for a long time, and then came to this place where we were able to prioritize that last year, and spoke with our very dear friend, Juancho, who is the main artist on the piece, and my beloved partner, Mario Jose Olvera, who supported Juancho to execute the mural. It was so fun because we came to them with these large, expansive ideas of trying to capture the essence of that, of honoring birth and parents and midwives, and this wish to create that connection between the birth and the death portal, and honoring the plants that support us as throughout these processes. We just laid it all out, and it was phenomenal how Juancho was able to bring it all together. He and Mario worked on that mural. He was working on the sketch for months and months, and then was able to bring the mural into being over the month of September. And then we had this incredible gathering with our community and invited a bunch of people out to come celebrate with us. It was open to the community at large as well. And we're able to have some shares and stories around midwifery and the impact of birth for families, and just had an afternoon. We blessed up the mural with our family's sacred practice of danza azteca and sweet prayer in that way, and music and sharing and food and fun through the day. So it was really amazing. And it's so fun to go by and visit the mural now and to see folks stopping and asking questions. It's stunning. And it's such a gift to our community.
Thank you for gifting that to everyone around. I want to just ask a question around, again, from my own experience. I was fortunate enough that our family had the opportunity to be in a place that had access to amazing home birth midwives. And for us, easy access to a hospital if transport were necessary, and also access to some financial resources that other people might not be. And most home birth or midwifery care is not generally covered by insurance. Is that correct? At least in Colorado?
Yeah.
So can you speak some to how you're trying to provide more access for people who might not generally have that access, and how that impacts the work that you do?
I would like to speak to the access issue. It's complex and nuanced as well on many levels. And so we can begin with looking at the access issues that are financial. As you mentioned, midwifery care is generally not covered in network plans via insurance, are able to bill as out-of-network providers, which for some people can be really supportive. Sometimes we're able to apply for gap exceptions, and something incredible shifted this year here in Colorado in that midwives will start to be able to bill Medicaid, which is honestly something I wasn't sure if I would ever see in my lifetime here in Colorado. We are also able to bill insurance for things that we do in-house here, like lab work, things that we refer out for ultrasounds. There are some ways that folks are able to use their insurance, not always. And certainly a lot of our people are underinsured or uninsured, regardless of what they may be able to find within their out-of-network plan. For example, often there's still payment barriers, and folks are then figuring out how to pay for our care out of pocket. We believe that our standard fee for midwifery is really reasonable and in line with the community standard here in our area when we're looking at cost of living. And even that, it's a lot of resource to pay out of pocket. We really built our collective on the tenets of increasing access to midwifery care. So few of our people can access midwifery care because of their financial burden. So we built the collective and decided to become a nonprofit so that we could create what we are hoping to be a sustainable sliding scale fee structure for our care. So folks who are uninsured or underinsured, under-resourced are able to apply for that sliding scale for our care. And we're able to access the sliding scale fees for people might visit us for supportive care, for reproductive, conception, counseling, lactation support, infant feeding support services as well. We're super grateful. We do a lot of grant writing and fundraising throughout the year. And although it is still very difficult to find direct support for midwifery care outside of the hospital or births, and we have been able to find some support to up that community sliding scale. So that's one piece on the financial access. And then also, it can be difficult to access midwifery care just simply because of not understanding what midwifery care is, what it may look like in your home setting. And so we're also working to educate our community. We show up and teach high school science classes around what midwifery is. We come out to local community events like farmers markets and Pride Fest and just places we know that we'll be able to interact and be with our community in a greater sense and just speak about what midwifery is and what the options are. There's so few people that think that they actually could ever access a midwife. And so it's nice to just be teaching people about what that can look like and how it actually can be possible and the breadth of our practice and the skills that we hold and what we're able to offer and provide.
In doing that, are you noticing an increase in interest in receiving midwifery care with
Yeah,
the science classes and the farmers markets and things like that?
we do. And it's slow. Change is slow. And so we've certainly had so much more interaction and teaching within our community. And the actual number of people accessing our care for home birth has stayed pretty steady. So we would love to see that grow. We also trust that this process is going to take some time. It's about people also building trust in themselves and in this process of birth and breaking down different ideas and fears that they have around being raised up in our very conventional medical system and models. So it's going to take some time. And it's fun to see how it happens for people. It's not always just that people come and jump to have a home birth. They might first start coming to our support circles or taking a class and then finding their way in that way. I wanted to speak also to the access issues for our Black and Brown communities. It's a huge disparity that we have here, really across Turtle Island. Maternal and infant outcomes really are the most dire for our Black communities. And from there, our marginalized and lower resource communities follow. And there's actually very few Black and Brown midwives here. Now, of course, that was different before the industrialization of medicine and the oppression of midwifery. We really stand on the backs of our grand midwives here about being some of the strongest lineage holders of traditional midwifery, our Black midwives. And then also a lot of the immigrant European midwives who were able to preserve the knowledge, and certainly the Indigenous folks of this land who were able to preserve that wisdom in their own communities. So it's certainly there. It's alive and very vibrant for a lot of our Indigenous communities. And unfortunately, midwifery can be a very hard thing for folks to access. It's just important to name that for myself, especially being a white-bodied midwife here and someone who was able to travel to learn from midwives and had that incredible honor and privilege to learn from Indigenous midwives. I had that support from my family and my community to become a midwife in my early 20s. And yeah, I hold this position with great honor and respect and a lot of privilege as well. It's difficult when you don't have care providers that represent you. And so for our BIPOC communities and our marginalized communities, we find that's even more difficult. That creates another barrier when they don't have a community midwife that represents them. And we can do everything we can to respectfully hold our communities in the best way. And it's a really important for us to be finding ways for all sorts of communities, especially our Black and brown midwives, to find their way through training so they can be supporting and representing their communities also.
Absolutely. I wanted to ask because you've done so much training and so much studying and have had the honor to learn from Indigenous peoples. In your experience, what you've learned, is it similar from, say, the Indigenous people that you've learned from and the grandmothers who've brought over things from Europe and people who have come from different kinds of communities? Do you notice threads that go through that bring all of the pieces more or less together in terms of the way they address birth and beyond?
Yeah. There's the essence of the whole person that is alive and well in these teachings, where we're not separating a body and a mind and a spirit. And that feels war to so much of the ancestral wisdom and the earth based wisdom. We're honoring our whole selves and certainly the spirit of the divine. And it has lots of different names, but the importance of tending that and keeping that fire alive as well, and how it so deeply impacts us in our human bodies, and also just a deep reverence for the earth and the gifts and the invitation there to stay in connection and communication, especially through these big processes of life and these rites of passages. So I do see those practices being really similar throughout different times and cultures. Also similar, I would say, would be the way that the postpartum time is looked at as such a momentous time, an important time for there to be full integration of the body, mind, and spirit. And I see those practices come into their own beautiful cultural forms throughout various communities, but be so deeply respected in the way that they are cared for by the community. And there's time. There's a time and a pause for that to unfold. And I see that across culture as well.
It's been such a pleasure speaking with you today, Lo. Could you please share just how people could find out more about your work at the collective and home birth midwifery care in general?
Absolutely. So folks can find us really easily through our website, which is midwifecollective.org. We welcome people to stop by. We're here in downtown Longmont, and we do have kind of a static Instagram page. So folks are welcome to look for us there at Community Roots Midwife Collective. We're meeting up with the community twice a month for anyone who's interested in pursuing or learning more about our midwifery care. And we have quarterly meetups for other folks in the community who may be serving and tending in similar ways and who want to connect, called Community Roots Connections. All of that can be accessed and signed up for on our website as well. We are super grateful to be reaching a broader depth of our midwifery work, which is really more traditional to midwifery. Some people say that midwifery is care from womb to tomb. So we are trying to reach that as much as possible. We have a fourth trimester program where we're providing in-home midwifery postpartum care for anyone who doesn't birth with us or doesn't want to birth at home. We also have an ancestral womb and postpartum care program. And through this program, we're offering closing of the bone ceremonies or cerradas. That's a beautiful way to support people's transitions in that postpartum time. An incredible ceremony that's been passed along through generations of grandmothers and teachers, holding that deep wisdom of what it takes to really celebrate and support that postpartum integration. So we offer that for anyone community wide who is in a postpartum period, and that can be post-release, post-miscarriage, postpartum of a baby who's here with us, and even post-trauma. So those traditions and the closing traditions that we're holding here are of Mexican Mayan lineage. This is a program that we partner with Harvest of All First Nations and Drylands Agroecology. It's an Indigenous-led collaboration, and we're really grateful to be offering those ceremonies to our people, for our people. Through that program, we have community knowledge shares and teaching cohorts that happen throughout the year, where we're bringing in new teachers and new elders and just really deepening into ancestral postpartum care and earth-based healing. Through that program, we also have our First Moon program, a coming of age program for our BIPOC youth here in the community. We have a weekly milk circle or infant feeding support group. That's free, open to the community.
Thank you so much for sharing that. And thanks so much for being here today.
You as well. Thank you.
Take care.
You too.
Thank you so much for listening to the Prepared for Parenthood podcast today. I hope you found this episode educational, informational, and conversational, and that you'll join me again for another episode soon. If you enjoyed listening to today's podcast, I'd very much appreciate if you would rate, review, and subscribe. If you're interested in more information related to today's podcast, or are looking for parent coaching or courses, you can find my information in the show notes or online at preparedforparenthood.com.